Hey guys, Dr. Jake Giese here. I am a physical therapist and a certified personal trainer, and I help people that are backpackers and hikers stay pain-free and on the trail, on to their next adventure. So what we're going to be talking about today is the top tips for somebody that has chronic back pain and how you can stay on the trail doing a next backpacking trip, hiking trip, that sort of thing, whether it's by yourself, with your family, or with your friends. So, chronic back pain is something that is very tricky. And if you don't know, haven't watched any of my other videos, I'm a doctor of physical therapy. I specialize primarily in people with back pain, back injuries, and I love helping backpackers, hikers, and other outdoors people. So, what you know is that with chronic back pain, primarily chronic back pain is going to be caused by muscle tightness or maybe even imbalances going on in the low back. And you'll generally find that it's right here and it's right above the waistband. Okay, right there. And you have a couple muscles there that are generally tight. So usually your quadratus lumborum, which is the one on the sides, and then your rector spinae, which are the ones that are kind of right in your middle of your low back near your spine. So the reason that's important is because despite whether you have arthritis, a spondolyolisthesis, stenosis, any of these spinal conditions going on, typically when you have something that's chronic, meaning it's lasting more than 3 to 6 months, right? You've had it for a while. Typically, your pain isn't necessarily associated to that specific structural change because your body knows how to adapt and it can heal itself if you give it the right tools to do so, whether that's sleep, nutrition, exercise, that sort of thing. So if you have chronic back pain, typically it's because of muscle tightness due to lack of mobility in that area, lack of blood flow to that area, that sort of thing. And the top tips that I give somebody that has chronic back pain and they're looking to do their next hike or backpacking adventure is talk to a physical therapist about treatment, and not only just your treatment, but how you can safely, or not safely, but how you can effectively and comfortably go on your next hike. So with chronic back pain, if we're saying that most of the time it's because these muscles in our low back here are tight, then you would think that stretching would be the right option for you. But actually, some of the best things that you can do, I find in my own patients, research, that sort of thing, is a technique called contract relax, or the fancy word is reciprocal inhibition. Basically meaning what you do is you're just contracting the muscle and then relaxing it. And you're contracting the opposite direction of what you want to do. So with your low back though, we are going to do a different type of inhibition or relaxing the muscles. So what you do is you would find a wall and you're just going to put your elbow up against the wall and you're going to lean against the wall, push, 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 and then relax. Now, it doesn't have to be you bent that far over. It's just that's where the wall is for me right now. But you would just put your arm into the wall and you're just going to lean into the wall. Now that you're going in a sideways direction, so that's going to be activating kind of your obliques, and it makes those kind of quadratus lumborum muscles back here kind of relax a little bit. Other options that you can do is you can just kind of work on going forward in a pain-free direction. So with all of this, we do not want to feel pain. It should feel good when you're doing these exercises. If you feel any pain, don't do it, or talk to your physical therapist, your doctor, before doing these exercises, okay? This is not medical advice. These are just educational things to help you try to be pain-free on the trail. So you're going to go down and then you can go ahead and then you're just going to try to arch back. Okay, and then go down and try to arch back. And when you go down, you're going to go down as far as you can. And when you go down like this, I want you to actually stick your butt back, like you're sticking your butt into the wall or something like that, right? And then you're going to come up and put your hands on your hips so you can go above your head like so, and you're going to reach back. And those are just general mobility exercises to help you get a contraction and get relaxation. So when you're going down, you're relaxing, and you're just going to try to I want you to almost push down even farther than you can. Push. Like try to go a little, even farther than you can, then come up. Then this is actually going to be the contraction phase of the back. You're coming back here. You should feel the back squeeze. And what I want you to do is I almost want you to just kind of push, almost like there's an object behind your head that you're pushing, and you should feel that low back contract. And what you'll find after all this, if you do like 7 to 10 reps of this, where you're just kind of holding it. So you're holding it for a couple seconds, like 5 seconds, and then relax, right? You can go down, and then we can go back up and down and back up. You'll find that the low back got some mobility back, and maybe your pain has decreased. The other quick fixes that you'll find, like cross balls, massage guns, foam rollers, that sort of thing, can be really helpful in the short term, but not necessarily the long term. So if you're using those methods, maybe that's why you have chronic back pain, is because you're not actually contracting, relaxing the muscles to kind of take pressure off those structures and give you less back pain. So hopefully that was helpful. There's a lot more things that I can talk about with this topic. Go ahead, comment below if you have any questions or want me to go into something more in depth, or you have some comments or your own story regarding this. Please go ahead, like the video. It would help me out a lot. And please subscribe. We're going to be talking about more backpacking, hiking videos, how to stay pain-free, talk about different exercises that you can do for mobility and as far as strengthening to stay pain-free on the trail. So if you're into that sort of thing, I'll see you on the next one. Take care, you guys. Have a good day.